Good afternoon. Welcome to one of the best possible breakout sessions over the course of these 2 days at Behavioural Exchange. I'm Tara Oliver. I'm the Managing Director of the Behavioural Economics team of the Australian Government. We're embedded in the Department of the Prime Minister and Cabinet. And I'm so pleased that the team's able to host this event for you over the 2 days. But first, I'd like to acknowledge Aboriginal and Torres Strait Islander peoples and the traditional owners of our land, Australia. We acknowledge the Gadigal of the Eora Nation as the traditional custodians of the place we now call Sydney. So why do I think this is one of the best sessions of BX? Well, in beta we've been looking, as others have been in the field of behavioural science, to show how small changes can assist people to keep their doctor's appointments, pay their taxes on time, and save more for retirement. But the scope is now widening, and behavioural insights teams, including beta, are now starting to shift the needle in areas of great social impact. And so I wanted to pick up a comment from Martin Parkinson this morning, the Secretary of our department. He asked if there's a second generation of behavioural insights we can harness to guide our approach to tackling the tough challenges we face in our hospitals, our homes, our oceans, our schools, and our communities. He invited us to think about the ways where we might be able to apply behavioural insights to make the world a little bit better, easier, cleaner, simpler, or faster. So I know this is something that we're thinking a great deal about in the Behavioural Economics team. So let's get onto it, because I know I'll be taking notes. Our first speaker is Dilip Soman, who's come to us from Canada. He's the professor at the University of Toronto's Rotman School of Management and co-director of the university's Behavioural Economics in Action at the Rotman Research Centre. He has also served as the inaugural director of the university's India Innovation Institute and has previously taught at the University of Colorado and the Hong Kong University of Science and Technology. He served as a scholar in residence and a senior policy advisor in the Government of Canada's Impact and Innovation Unit. He's the author of several articles in the area of behavioural economics, and he's written one of my favourite books, The Last Mile. And I hope his presentation today will talk to us about whether we're going the last mile or indeed we're running a marathon. So welcome Dilip Soman to the stage.
Thank you. Okay. Thank you, Tara. Thank you for hosting this lovely conference. It's actually a landmark conference in many ways. I think the biggest way in which it's a landmark conference is it's the first BX after the 10th anniversary of Nudge. So Nudge was, I think, first published April of 2008. We've come 10 years since then. Nudging is part of people's lexicon. We all talk about it. We breathe it. But 10 years, as my friend Katie Milkman would say, is time to take a fresh start. It's time to look back. It's time to think about what we've accomplished, and then look forward, look ahead, and think through what's next. So what I'm going to do in my talk is to be academic about this whole thing. I'm going to spend a little bit of time talking about what I think the future is going to look like for behavioral science, and then what we need to do to get there. So those are my two themes. The other theme in the behavioral science, everyone that's read The Last Mile knows this, that time is a very malleable concept. So I'm going to speak for what feels like 15 minutes. But I'm sure that if I go on for longer, somebody's going to stop me. So I'm looking at you. I see your. She's already holding up the stop. So let me sort of do the following. I'm going to make 3 claims about behavioral science. I will talk about what I call the canvas of behavioral science. In other words, what other stuff can we do beyond simply nudging? I'll talk about something called behaviorally informed organizations. So think about either a firm, a government, a not-for-profit. What is it that they can do to become quote-unquote behaviorally informed? And I'll end up with a little piece on the cost of experimentation and what we can do to bring it down, because at the end of the day, the ability for behavioral science to actually impact the world and actually make a difference in organizations is predicated on our ability to bring down the cost of experimentation. So that's my agenda. Let me start with 3 claims. Claim number 1 is that all organizations are fundamentally in the business of behavior change. I mean, I cannot think of any organization, government, for-profit, not-for-profit, that doesn't change behavior. That's what we do, right? It's also, there's a corollary to that, which is most organizations aren't very good at behavior change. And they're not very good because it involves dealing with humans. And we know that humans are unpredictable. We know that they're emotional, all of the usual stuff that I don't need to preach to this crowd. Claim number 2 is that fundamentally all complex policy problems can be broken down into some very specific behavior change challenges. And there's a lot of similarity in those challenges across policy areas, and I'll spend a minute on that in a minute. And those similarities make it easy for us to be able to learn from some domains and apply them to other domains. So what are these precise challenges? Well, there's 4, right? And so every single behavior change challenge that we look at pretty much falls into one of these 4 buckets. Compliance. This is a pretty straightforward one, which is we want people to do things, file taxes, get permits, file paperwork, by following certain standards by a certain period of time. We know they don't do it. How do we get people to comply with that? Another big category of behavior change challenges have to do with switching or purchasing behaviors. People are currently doing A, and you want them to switch to B, right? Now, A could be eating junk food. You want them to eat healthy food. A could be that they're not exercising. You want them to exercise. They're not saving for retirement. You want them to save. But that's a big class of problems that we often deal with. Consumption is another big one. Is as governments, as organizations, we often want people to consume things. Those things could be information. So think about a privacy commissioner's office. One of the biggest things that they worry about is how do I get people to read privacy policies? Right? And we know that that's a big challenge. We've kind of dealt with some of those issues in Canada. And then likewise, medication. It's a big thing. As you can tell by looking at the color of my skin, I'm South Asian in heritage. And like every good South Asian, I have cholesterol problems, which means I need to take a medication every single day. Now, the problem is every one of those pills doesn't really do anything. I don't feel any different after taking the pill. And so in domains like that, getting adherence to medication regimes is a big challenge. So how do we get people to consume medication? Another big problem. And then finally, acceleration. This is the central theme of behavioral science. This is what makes humans human, is all of us have great intentions to do everything tomorrow, but not today. So how do we get people who have decided to do something in the future to do it at the right time, right? So I'd make the argument that all of our behavior change challenges fall into these 4 buckets, and as long as we have a nice, clear understanding of what the dominant methods of achieving behavior change are in each of these buckets, there's a lot of learning where we can scale from learning in one domain to other domains, and I think we need to see a lot more of that going on. So more generally, just taking a step back and saying, what does the canvas of behavioral science look like? A lot of people will going to use the term behavioral science interchangeably with nudging. There's a lot more than that, right? And what I've tried to do here is to talk about 4 broad areas in which I think behavioral science can and should make a difference going forward. So obviously there's choice architecture, top left. This conference is all about that. I'm not going to get there. But there's a few other things. One other thing is the notion of design. So at some point in time, you would make the argument that if products and processes and programs are behaviorally well designed, you shouldn't have a last mile problem. Right? Can we design products and processes with the assumption that our end user is going to forget stuff, or that they're going to be impulsive, and so on and so forth? And we need to do a better job of marrying what we know from design with the behavioral sciences. We're doing a bit of work in that area at Bayer, but I think we need to do a lot more. So bringing the behavioral sciences into design, I think, is a huge opportunity for behavioral science. Better decision-making tools. So at some level, we say, well, look, people can't make the right decision. They're impulsive. They don't think a whole lot. Can we help them by giving them the right tools? Can we help them by giving them the right information? A massive opportunity in that space is designing decision tools, calculators. You could think about sort of various different ways in which you could do this, but essentially tools designed to help people make better choices. And then on the top right, this is another an area where we're doing a fair bit of work at Bear, which is developing a market for self-control. A massive set of behavioral challenges lie in the fact that people have great intentions, but they just don't get around to doing them. So how do we actually help people accomplish what they want by creating products and services that essentially get them to lock their intentions and convert them into actions? We've seen examples of this in all kinds of domains. So Taylor and Benazzi have Save More Tomorrow, which is a pre-commitment type device. But there are many other such products and processes we could put into place to help people make better choices. So I'd say that there are 4 broad areas. We've done really well in choice architecture, but I think we need to go beyond and think about the other areas as well. So how do we do all of this? How do we actually take these ideas, look at the canvas, and then think about building an organization, be it within a government or in the private sector, and make it as behaviorally informed as it can be? And I think there are 3 questions we need to think about. Where do you want to be? There are different levels at which you could be a behaviorally informed organization. How do you get there? And then finally, what resources do you need to develop, right? So those are the 3 quick questions that I'm going to try and answer. And by the way, everything that I'm going to talk about today will be in a report that will shortly be available. So any questions, let me know. I'm happy to actually outsource my responses to a report, which you can then read. So where do you want to be, right? And I look at different steps of behaviorally informed by looking at different roles the behavioral scientists could play in an organization. So let's think about the lowest step, right, which is the behavioral scientist as a problem solver, right? That's what we all do. Our minister says, well, there's this welfare program, take-up rates are very low, help me. We solve a problem, right? A lot of the choice architecture interventions that we'll hear about at this conference that have been published over the last 5 or 10 years have all been in the genre of the behavioral scientist as a problem solver. We've tried to identify what the problem was. We tried to reduce the friction. We tried to encourage people to make better choices. But there's a problem that actually is the core of the behavioral scientist activity. But let's think about an organization where we go one step up, right? Think about a behavioral scientist as an auditor. Okay? So think about a company, think about a government where as every program is being designed or shortly after it has been designed, it actually has to pass the scrutiny of the behavioral scientist before it is actually launched, right? So essentially it's preventive science. Can we use the behavioral scientist to look at programs, to look at products, to look at processes, and then audit them? And that might still involve doing randomized controlled trials or experiments or whatever else, but fix the problem before it actually hits the last mile. A nice example of this is some work we've been doing with the Privacy Commissioner's Office in Ottawa on disclosures and privacy statements which people don't read. And I got interested in this problem because a few years ago, I think it was 5 or 6 years ago, my then 11-year-old son was doing this sitting in the living room on his tablet computer. And I said, Neil, what are you doing? And he said, well, Dad, I've just downloaded this new thing called Instagram, and this is everything I need to agree to before I can start using it. Right? And so I kind of, I figured out who Instagram was, and I gave them a call, and I learned about their privacy policy and how it was generated. They had apparently hired 26 lawyers and legal assistants who did nothing else for 6 months but craft that privacy policy, which nobody reads. Right? And it's a well-written document. It's actually a good document. But as a behavioral scientist, that was the worst timing I could have chosen to deliver that information. Right? My son has just spent like 4 minutes, which in this age is like an age, downloading something that he's heard about from all of his friends, and I'm preventing him from getting there by making him read a privacy policy. And if only somebody had audited that particular decision-making process, that particular design, then in fact it would have not been as big a problem as it is now. So we are actually working now to move to a regime where for the first instance of use, you can actually use the app without consenting to the privacy policy. But the second time you open the app, then in fact that's when you have to read everything. And our early results actually show that people are much more likely to read when they've played that game for the first time. So that's the sort of role that behavioral scientists might have as an auditor. You think about behavioral scientists as designers. Right? So imagine a team where, in fact, there is a behavioral scientist, there's a judgment and decision-making expert in every single design team. All right? So that's even moving up the value chain. We ended up with the last mile. Now we're going down to auditing, which is after the thing has been designed, moving up to the behavioral scientist as a designer. We are working with the regulator, regulator of financial markets in the province of Ontario. And one of the things that we realize in talking to them is that regulations for financial services are made for econs and not for humans. Right? They're made for people who process information, who want to maximize their own well-being. Privacy regulation, same thing, right? The first assumption implicit that the privacy commissioner makes is that citizens want their privacy to be protected. And most people don't, or haven't even thought about it, right? And so changing the assumption on which you design programs and policies, I think has a fundamental effect on how we think about those programs and policies. And then finally, you could think about the behavioral scientist as the chief strategist or the CEO of the organization, in which, in fact, almost everything that's done by the company is behavioral in terms of being empirically driven, evidence-based, and where the company tests, learns, and adapts all the time. So there's no right rung at which one should be at. It kind of depends on how big the organization is. But I'd say step one is to figure out where on this ladder you want to be. How do you get there? Right? And I'd say there are two decisions that need to be made. One has to do with where do you put your expertise in your team? 2 minutes, 2 real minutes, okay? And the second is, what's the locus of applications? Right? You could think about sort of a narrow set of expertise, kind of an internal consulting unit, if you will, or a behavioral unit, or whatever else, versus a broader one, which is more sort of capacity building. Everybody in the organization should think like a behavioral scientist. And then you could sort of think about the application areas as well. And top left is our problem solving, right? I've got a narrow team that works on specific problems, last mile challenges. That's what a lot of the government units are. Or started off as nudge units, is let's nudge people because we see a problem, let's solve the problem. But over time, I suspect we'll move down to the bottom right, where not only do we start looking at challenges that are not last mile, but we also move up the value chain. What resources do you need? Okay, 3 things: engagement, expertise, and empiricism. Right? And I'm not going to go through all of this because I think I want to sort of move to spend my last minute on the last idea, which is the cost of experimentation. Right? Now, we know from, it's kind of interesting that we use traditional economics to help behavioral economics become better. Right? So we know from the laws of demand and supply that when things become cheap, the demand for those things go up. Right? So when experimentation becomes cheap, the demand for experimentation should go up. When the price of something goes down, the demand for complements goes up. The demand for substitutes goes down. All right? So if you can imagine a world in which experimentation is costless, right? You're sitting in a policy meeting and somebody says, well, what if? And you just press a button, somebody runs an experiment somewhere, and you have the answer, right? Now we don't, I hear the bell. Now we don't need to think about whether or not I should do stuff and so on and so forth. And so to me, the biggest stumbling block for behavioral science to become more influential in the organization is to reduce the cost of experimentation. I have a quick checklist of what the drivers of those costs are, but because the bell has rung, I will not go through all of this, but I'd be happy to share my notes later. So thank you, and to you.
audience as well. So I'm going to speed this up because I think we have dedicated time right at the end to take questions from the audience. And so rather than getting up and down all of the time, because we have such a set of great speakers here, I'm just going to roll through the next introductions. And Kate Phillips is our next speaker up, who we actually met just earlier on the plenary stage, having a conversation with Cass Sunstein. Quick reminder, she is the principal at the Victorian Behavioural Insights Unit, providing oversight on the application of behavioural insights to public policy challenges in Victoria. Elizabeth Hardy. So we're also bringing up another Canadian to the stage today for you. And Elizabeth is the Senior Lead Behavioural Insights at the Impact and Innovation Unit, overseeing the application of behavioural science and design to public policy challenges. Prior to joining the Government of Canada, Liz had several senior leadership positions, including leading the BI unit in the Government of Ontario, where she was instrumental in creating and building Canada's very first behavioural insights team in government. And Liam, we're bringing up another Aussie as well. So we've got a nice split of international and domestic speakers on this topic. Liam established the BehaviourWorks Australia organisation in 2011, and he's overseen significant growth in that organisation, with the research group now numbering 28, mostly academic staff. Liam is committed to drawing on leading behavioural science insights to help solve the problems that face society, and making BWA a bridge between academic research and practical real-world solutions. He does this in many ways, including conducting and overseeing, I really wanted to say this, 250 projects. That's really amazing. So there you have it. There are our three next speakers. So I'll invite Kate to come up. Please make her feel welcome.
Thanks, Tara. Too easy. All right, so I'm Kate Phillips. I'm from Victoria's Behavioural Insights Unit, based at the Department of Premier and Cabinet. And before I get into talking about what I believe the second generation applications of behavioural insights might look like, I thought it'd be helpful to take a step back and think about where in the policymaking process behavioural insights has been applied to date. So this is a policy cycle, and while reasonable minds might disagree about whether or not this is best depicted as a cycle or a linear process, I think it's fair to say that policy design generally begins here in the bottom with identifying what are the issues at play. After that, we move to analysis, choice of policy instruments, some consultation and coordination, a decision is taken, and then we implement and evaluate those policies. And to date, behavioural insights has largely been applied within policy implementation to optimise individual services. This has generally been through very targeted application, trying to change a specific behaviour, like how can we get people to pay their tax on time? And RCTs, randomised control trials, have been our tool of choice. RCTs are a particularly good tool for this, given the premise of behavioural insights is that things that supposedly shouldn't influence our decision-making, or supposedly irrelevant factors, as Richard Thaler would say, turn out to influence our behaviour quite a lot. So whether that's the order that things are presented on a form or what other people are doing, these supposedly irrelevant factors do actually change our behaviour, which makes experimentation a very natural tool in the behaviouralist's toolbox. If these things are relevant to our decision-making that shouldn't supposedly be, then we need to test to find out what works. The next generation of behavioural insights in government, however, I believe can and should in some circumstances involve decoupling behavioural insights from experimentation. RCTs have brought more evidence into policy, and this is an excellent development. However, I believe that our desire for evidence-based approaches is restricting us from applying behavioural insights in some really useful ways across the policy cycle. And so I suggest that the second generation of behavioural insights in government will involve applying behavioural insights to policy making, and will also involve being more proactive about how we think about behavioural insights in concert with traditional policy tools, information, regulation, and incentives. A few quick examples from Australia of where behavioural insights has been successfully used at the optimisation stage. A trial that we ran in Victoria with BehaviourWorks Australia involved sending behaviourally informed text messages to parents to get them to get their kid to school on time the day of the HPV vaccination clinic. And this was very effective at getting people to actually come to school. While neither of the behaviourally informed text messages was better than the other statistically, there was a statistically significant drop in the share of unvaccinated children if you did receive a text message. Similarly, in New South Wales, and this was referred to at some of the earlier sessions, but New South Wales has used text message reminders. The Behavioural Insights Unit here worked with St Vincent's Hospital to reduce the share of missed appointments. Simply sending people a text message, and they tried a range of behaviourally informed messages, did in fact improve the attendance rates at specialist clinics. At the Commonwealth level, our colleagues in the Behavioural Economics team of Australia worked with the Australian Energy Regulator to test the impact of behaviourally informed fact sheets on how energy consumers feel in terms of their confidence about their energy plan. So I think overall, the use of RCTs is a hugely positive development. RCTs enable us to understand what works, for whom, and in what circumstances. But are we ignoring the wood for the trees? Policy lays the architecture within which all programs and services must be developed. And so by the time programs themselves are designed, key decisions about the overarching policy objective have already been decided. If we start with identification of the issues at play, and then look, you have to get all the way around the cycle before you come to implementation, which is generally where behavioural insights has been applied to date. Policy analysis and decisions about which policy instruments to use, however, regulation, incentives, information, take place much earlier in the policymaking process, long before we get to program implementation. Applying BI at the policy level, therefore, has the potential to deliver much broader impact than optimising individual programs or services alone. But is it possible to apply behavioural insights to policy creation? By this, I don't mean policy creation, the process. There's certainly scope to use behavioural insights in that regard. For example, by modifying our processes so that we're less likely to fall prey to sunk cost or status quo bias. But what I mean here by applying BI to policy creation is thinking about how we can use a behavioural lens to understand the policy problem and design the policy architecture long before we get to the design stage, designing a specific program to meet a policy objective. On the plus side, applying behavioural insights in the crafting of policy has the potential to generate greater impact, greater benefit for citizens than their application to service optimisation alone. But how will we know if it works? Testing policies against one another is rarely viable. We can't often randomise who gets which version of a policy for a whole range of good reasons. Equity, practicability, politics, legality. If we're going to introduce regulation, for example, it would put some firms at an unfair advantage if some firms had to comply with the regulation and other firms wouldn't, even if running an RCT in such a way would help us to get to the heart of whether or not consumers are better protected. So how are we going to know if behaviourally informed policies work? The right answer to this question is, I think, another question. What's our counterfactual? What would the outcome be if we were to take a different path? What's the counterfactual is a thought experiment similar to Schrödinger's cat in quantum physics. We never actually get to observe both states of the world. We can't both receive an intervention and not receive it. RCTs, of course, solve this problem neatly through randomisation. If we randomly select who gets the intervention and who doesn't, we're able to disaggregate the causal effect of an intervention. So what's the counterfactual to applying a behavioural lens to policy design? The appropriate comparison group, I believe, isn't the methodology with which behavioural insights has been applied so successfully to optimise programs, largely RCTs. Rather, it's how the policy would have been crafted rather in the absence of using a behavioural lens. The counterfactual is not considering the biases and heuristics that we know people use to navigate life. Instead, it's applying traditional policy tools using assumptions of classical economics, assuming that people will be able to understand information and know what to do with it, that will rationally weigh up pros and cons, incentives and regulatory constraints in deciding what to do. An example of where this has been applied in Australia to policymaking is the case of plain packaging for cigarettes. So in 2012, the Australian government introduced new laws that mandated that all cigarette packs are a drab olive colour with brand names to be provided in specific font, size and location on the pack. The packaging doesn't alter the cigarettes contained within. It's a supposedly irrelevant factor. But we know that such factors influence our decision-making as humans. Two BI concepts are particularly relevant here. Salience, making graphic health warnings cover a much larger proportion of the cigarette box, and attractiveness. Plain packaging removed the ability for brands to make cigarette packages attractive, using their own logos and graphic design to attract attention and make the product seem more appealing. Behaviour change as an approach isn't new. Government's always been in the business of behaviour change. But the application of behavioural insights allows us to think about how we change behaviour much more systematically. In this case, behavioural insights was used to inform the policy design, but the effect of plain packaging on the desired behaviour change, smoking cessation, wasn't empirically tested via an RCT before implementation. It just wasn't possible to do that. So what did we see? Well, the post-implementation review indicates that smoking prevalence among adults in Australia has dropped after the introduction of plain packaging in 2012 by over 0.55 percentage points. I stress this is a before and after analysis. We can't conclusively determine causation. We don't have an RCT, but we do have some good evidence that the policy was effective despite this. This is an example of where we've successfully applied psychological concepts even when it wasn't possible to test before implementation. I should stress at this point that this is not to say, obviously, that we shouldn't evaluate things. We can and obviously should evaluate so that we can find out what works. The point here is that we won't always be able to experiment to know what works in advance of the policy rollout itself. The next generation of behavioural insights in government, I believe, will also focus on how behavioural insights can be applied in conjunction with traditional policy levers: information, incentives, and regulation. And I think plain packaging is again a good example of this, a good example of behavioural insights working in a complementary manner to regulation. From a firm perspective, this is hard-edge regulation. It's traditional policy. It's a mandate. There's no way that a firm can opt out of complying with the legislation. But from a customer perspective, plain packaging shouldn't make a difference. It's a supposedly irrelevant factor. Doesn't affect the cigarettes that are contained within the package. In Victoria, we've been increasingly thinking about how we apply behavioural insights to policy design in complex spaces. For example, our team was asked to do some work to understand what influences frontline workers in the family violence system to share or not share information. This work fed into the response to Recommendation 6 of the Royal Commission into Family Violence. And Rec 6 essentially recognised that changing the legislation and changing the technology to support workers in the system to better share information wasn't necessarily going to produce the desired behaviour change. So we were asked to do some exploratory work to understand the psychological and contextual factors that influence information sharing. We went out to a number of different magistrates' courts and a specialist family violence service agency, Berry Street, to better understand the context in which people do or don't share information with other parts of the service system, including where that's an active decision to share information and where it's not. Information sharing could look like a number of things here. It could be workers extracting information from a database. It could be a court worker calling the police for additional information. Some of the things we uncovered through our fieldwork and exploration of the literature were expected, but others were more surprising. For example, we found that workers use the process of seeking consent to share a victim survivor's information as part of a process through which to empower victim survivors. We know that family violence is about power and control, and victim survivors have often been actively disempowered by the perpetrator. And so seeking someone's consent to share their information might not seem like a big thing, but it's giving back to that person some very small metric of control. You control your information and how it's shared in a very disempowering environment. Why is this important? Because if that's a process that family violence workers use in practice, then changing the legislation, changing the technology, isn't necessarily going to achieve the desired behaviour change. Similarly, we found that physical design of buildings is really important, as it can make it slightly easier or slightly more difficult to share information. We heard practitioners in the courts, in the magistrates' courts, reflect that when they worked from courts where they sat behind the registry and the police had to ask the registrar, hey, can you go get Kate for me? I'd like to speak to her about something, that information wasn't shared nearly as frequently as courts in which they could simply go and knock on the practitioner's door and have the conversation. This is a tiny cost. It's seemingly insignificant as a friction, and yet it was sufficient to stop workers sharing information. These insights have fed into the design of Victoria's support and safety hubs to ensure that physical design frictions that impede information sharing are removed wherever possible. Insights from this work have also been fed into other aspects of the regime, including a fast and frugal decision tree in the ministerial guidelines of when to share and not share information and what consent is required, and the design of training in the new information sharing scheme. So, have these insights made an impact? The answer is we don't know yet. The Victorian Family Violence Information Sharing Scheme will be reviewed at both the 2 and 5 year points after its implementation. And given the many changes to the system overall, we won't be able to neatly disaggregate causation with, a nice bar graph with error bars. However, I think it's important to stress that wicked problems are rarely amenable to solutions that focus only on implementation of one program in one part of the system. So, what will the second generation of behavioural insights application in government hold? I believe it will include using behavioural insights at multiple points in the policy-making process to understand the problem, to design the policy architecture, as well as to optimise the services that ultimately sit within this framework. All programs and services sit within a much broader policy architecture. Thinking about human behaviour when we design policy itself has the potential for much greater impact than applying behavioural insights at the service design stage alone. However, this is going to mean sometimes decoupling behavioural insights from experimentation. And again, just to stress, this is not to say that we shouldn't evaluate. We absolutely should find out what works. And I think RCTs are always going to be a really important tool in the policy practitioner's toolbox because they're a way to disaggregate causation, which means we know which bits of a program to replicate in other areas. But rather it's to say we can't always experiment to find out what works before implementing a policy, given we can't often randomise at the policy level. Yet, we should still bring what we know about human behaviour to policy design, rather than relying on traditional models that we know don't represent how people actually behave. We can, and in some circumstances should, decouple behavioural insights from experimentation, because people's decision-making is too important to leave to the optimisation stage alone. Thanks.
Welcome everyone. My name's Liam Smith. I'm Director of a research unit called Behavioural Australia based at Monash University. Thank you, Tara, for the introduction. Thanks for the 2 great presentations ahead. I'm a psychologist, it's my background, but actually my interests are much broader than that. And we employ 28 people, but some of those people are deliberately not from psychology or economists. They're people who come from sociological or broader sociological perspectives. And indeed, I sit within an institute at Monash University where we have lots of different disciplines and we work together to try and solve problems. So you're going to have to forgive me for this presentation because I'm going to pretend to be a sociologist for about 2/3 of it before I swap my hats and become a psychologist, a territory I'm much more comfortable with. So I guess we've talked a lot about behavioural nudges through the course of the conference so far, and I'm sure we'll hear many more. But yet many of the social issues remain. We see that 1% of wealth is 22% of wealth is concentrated in 1% of the population in Australia. This is a picture of the Christmas Island pipistrelle, a species that's probably just gone extinct. Obesity, we heard from Martin Parkinson this morning, over half Australians are overweight or obese. And of course, climate change continues unabated, despite our successes in behavioural change and trying to change people's behaviour. So in thinking about these challenges, there is an agenda that's largely set, one that many of you will be familiar with, although in government I'd hasten to say that it's not as well adopted as it probably should be. In 2015, 193 countries ratified the Sustainable Development Goals, and they are just as relevant to Western society, or what so-called Western society, as they are to other countries. They are the agenda. They are the change we need to make. So in thinking about how behaviour change and behavioural science can help solve some of these problems, and I'm an academic, I'll start with theory. This is a methodology that our research unit uses to understand problems, unpack them, identify behaviours, test and trial solutions. But one of those very important wedges is theory, proposed theories. Why does theory matter? Because when you design interventions based on theory, they were more effective. It's been proven time and time again. In this phase of our research process, what we try and ask the question, and the theories we try and bring to bear, are the theories that say, why are people doing the things they do? What is it that leads to people behaving in a certain way? And that takes us very rapidly to thinking about some broader social structures or market structures that also inform behaviour. It's not just our innate biases or our internal cognitions. There's systemic issues that need challenging. And if we want to achieve the SDGs or solve the sustainable development challenges of the world, we need to think broader. So to borrow from one of the popular visual metaphors that are used in system change, we talk about shifting regimes. Regimes are systems of government, of law, of policy, of markets that then manifest in social norms and how people act. Sociologists call this a regime. And we see here we have a state where we sit in one regime. But to break out of that, we need to cross a critical threshold to get to a second regime state. Very common metaphor that we see. And for that second state to be sustained, most sociologists will tell us we need three really important ingredients. Number one, engaged individuals. Number two, political opportunity. Number three, organisations, good organisations with systems of governance that are able to support the change. Any one of those three things are missing, and it's unlikely the change will be sustained. So in thinking about how a lot of the nudge strategies work, or behavioural insights strategies work, I guess the proposition is that in some ways they reinforce the regime. Sociologists talk about structure and agency. So agency is our individual ability to act. The structure is the regime that supports that action. And if we sit within that, essentially you might argue, and behaviour change can happen within those structures, what you might argue is that they reinforce them. They make the problem worse. They say that people can act and change behaviour within an existing system, therefore the system is validated. It's a very confronting idea, but the logic is there. I hope you can see it. So in some ways, the work that we do, and my unit does, makes problems worse. I think second generation nudges and the sorts of ideas that Kate was talking about, I think they do have a place. And to me, they do destabilise the system a little bit, but do they get us to the tipping point of change? I'm not quite sure yet. But I do want to go a bit further back than this, to think about where the drive for change comes from in the first place. What strategies are there in place to get people or to get a society to want to change? And I guess you can broadly call these in two categories. There's man-made ways that we can create burning platforms and lead to change, but there are also natural disasters. But both provide a platform on which we want to get change. So that's the impetus to shake that ball out of the first cradle. So back to our model of what we need to sustain change. Engaged individuals. And the reason I put this up, because I think this is where behavioural science can help inform and motivate a public or publics to drive change. Now, there are lots of ways to think about how you motivate publics or how you get them engaged in issues or change attitudes. There are many, but I'm going to use attitudinal a tool. The things like diffusion of innovation and the like are very well established tools for how change happens. But how do we create an engaged public that wants change? And so I'm using a simple division here with people with weak attitudes about opinion about the issue that matters. So whether it's one of those sustainable development goals, whether it's climate change, whether it's obesity, whether it's any of those other issues. But people who have weak attitudes or opinions about it, I think they can be shaped in a particular way through what a great colleague of mine calls sensitising the market. This is providing a moral, social licence to act. And I've got a great example of this from Victoria, which I'll play in a minute. But just to contextualise this, Victoria 15 to 20 years ago had one of the least safe workplaces in Australia per million hours worked. There was a series of social marketing campaigns that ran to try and encourage people to essentially change behaviour in workplaces. And this is one of the campaigns, one of the videos or the pieces of the campaign.
Is your husband Robert Henderson? Robbie's at work. Mrs. Henderson, can we speak to you alone? Yeah, of course. Is he okay?
Would you mind if we came inside, please?
The most important reason for making your workplace safe is not at work at all.
It's actually hard to watch that without getting emotional. It's a very powerful campaign in building moral and social licence to act. In fact, it builds public support in a way that enables your behaviour change tools to prove much more effective. And underpinned by that social licence brought by this campaign were a whole suite of interventions, all running consecutively. Incentives-based ones, tougher legislation and inspection, tougher fines and penalties for those that did the wrong thing, environmental restructuring, community engagement programs. They all underpinned and were flowed from the campaign, which had support because of the moral and social licence. I don't have a trend graph, probably should have put one up, but Victoria's workplaces are now the safest in Australia and one of the safest in the world by per million hours worked. It's a fantastic story and it works really well where attitudes are weak. So where the attitudes are not strong and it's not on the public agenda and people haven't thought and contemplated and formed strong opinions about things, we can shape them through social marketing. But it has to be followed up by a suite of tools that work. What about the other instance where we have really strong attitudes? So people think they have strong opinions about a particular topic and we need change to come through public appetite. This is a matrix that we use a lot in our work, which outlines essentially two dimensions of prioritising behaviour. One is the impact that people performing that behaviour will have, and many of you use those tools when you think about the impact. And the other one is the likelihood that people will do it if you ask them. And you can see there's one category here in particular, which I'm going to come back to in a minute, in the bottom right-hand corner, which says it's easy but ineffective. These are things that people can do, but won't necessarily make a big impact on the problem at hand. I'll come back to that in a minute. The other great body of literature which sits in the psychology, attitudes have been researched for many, many years, is the relationship between attitudes, our opinions about things and our own behaviour. We know for a long time that these two things work each way. So things I'm passionate about can guide my own behaviour, but my own behaviour and observing it can actually shape the things I'm passionate about. There's been many studies, for example, where you give someone $1 and say, put it in that homeless person's hat, you will redefine how you see yourself by virtue of your own action. And we know that we might be able to reinforce those through feedback, providing feedback to people about their own action. Hey, you did that. And particularly, and two doctoral students of mine have just finished, or just finishing, when you use tools that reinforce a new identity and reinforce the fact, self-efficacy, which is the fact they can do the behaviour. We know these act as mediators. In other words, hey, you did that thing, you must be that type of person, therefore your attitude should be this. We know this works. And then attitudes, of course, can reinform behaviour. We know this from a great case study, and I think there's a need for much more research in this space, but the case study that Robert Cialdini talks about of prisoners of war in the Korean War, and in China, what they did to try and convert them from capitalism to communism was a whole suite of small behaviour change steps. At first, they would be asked to agree to the fact that communism wasn't all bad, that capitalism isn't perfect, that unemployment wasn't a problem in communism. These are small, subtle things that most of us would probably agree to, despite which camp we're on. And if we agree to these very small things, and then particularly the magic ingredient is to make them public and sign our name to them or make them available to others, it can shape who we are. Chipping away at significant attitudes was done. And this is a picture of a particular prisoner of war who converted, like many did, to communism and didn't come home after the war ended. Stayed in communist China. So thinking about how we might translate this into some practical tools, this is some work of one of my doctoral candidates, Sarah Kneebone, who looked at water-saving behaviours. I don't want you to look at the data. I really just want you to think about the principle. She put a whole bunch of water-saving behaviours onto a matrix. Impact on one column, the likelihood of performance on the x-axis. One of the really nice things she did in her work was think about which behaviours people perceive to be similar. So which behaviours people in their own mind group together as achieving a similar goal or as being a similar type of behaviour. She had a whole bunch of cards with behaviours on and people were asked to group them together and say why they did that. And these are some of the categories that came out. What actually doesn't really actually matter what they are, but there's a whole bunch of them. And they've got names and labels and you can read a thesis at some stage. But what we really want people to do is go from this bottom right up. So from low impact behaviours, small things that seem inconsequential, And if we reinforce a new identity and we reinforce self-efficacy, you're a can-do person who can do these things, maybe we can leverage up to similar behaviours that are much more impactful and redefine attitude even more. It's a way of chipping away at a really strong attitude. How might this look in practice? Well, for example, and I've never run this trial, although I've asked many public utilities to run this. Imagine if you're catching the train, like I do regularly to Melbourne City. I do it for lots of different reasons, but one of them actually isn't to save the environment. But if on the back of the chair it told me that I'd saved 1 kilo of carbon every day, and I did that for 220 days a year, I can do the maths. I'm actually making quite a contribution. So you see how these things can play out in the real world. I'm conscious I'm out of time, but they're the key take-homes. Thank you.
Hi, good afternoon, everyone. Thrilled to be in fabulous Sydney, Australia for the first time, so thank you for the invitation. So I thought I'd start just to give you a bit of context where we're at in Canada. So right now there is a strong push to innovate and experiment. This is happening for a number of reasons. We are facing persistent public policy challenges. There is a gap between policy development and implementation. So we've been finding that we're not paying enough attention to implementing a policy when we're creating these policies, and more attention needs to be given to that. There's a capacity issue. Do we have the right skills to tackle the problems of today? And we have an inconsistent approach to measurement, so how we measure success. And of course, something that I'm sure public servants in the room will relate to, an inherent aversion to risk. So I work at the Impact and Innovation Unit, which is part of Privy Council Office, which is equivalent to your Cabinet Office. And we do a number of things, including behavioral insights. We also look at impact measurement, so how are we effectively measuring our efforts. We also look at innovative funding, so things like prizes and challenges, social impact bonds. We've been around for a few years, and we act like an internal consultancy, helping departments and agencies improve their outcomes. So I thought what I'd do today is talk to you about the evolution of our work. So to begin, I'm going to review some early work, give you 2 examples of some trials that we've run, and then move to second generation. So here you'll see in trial 1, we ran a study with Statistics Canada, which is our national statistics agency. They're experiencing a steady decline in the number of citizens completing our mandatory surveys. So in this case, we worked with them on this survey to see whether we could help increase response rates. And for this one, the collection process is this. So they phone farmers across Canada between the hours of 8 a.m. and 8 p.m., so at some random time, 7 days a week, and they say, do you have 60 minutes right now to complete a telephone survey? 60. I love that. I think, like, please call me at 5 o'clock on a Monday and ask me if I have 60 minutes. What we did was we tested a reminder letter, but we also tested a process change. So we gave farmers, individuals, businesses, the opportunity to phone us at a time that's convenient for them. So they could either just, okay, get the letter, you know what, I do have time right now, I'm going to phone. Or they could phone and pre-schedule an appointment. So by making this change, we saw a 6.8% increase at the national level, but in some provinces, upwards of 15.8%. A second trial I'll just touch on quickly is some work we're doing as part of our charitable giving work in Canada to increase charitable giving. We partnered with Heart and Stroke Foundation. This is a large national charity. And for this trial, we sent out 225,000 emails, so pretty large sample size, to see whether we could have an impact. So some main concepts we tested was the addition of names of past donors. We looked at the promise that no donated funds would go towards overhead costs. we also added some testimonials. So Liz Hardy donated because my dad had a stroke last year, so this is why it matters to me. And we also looked at matching funds. So in this trial, there weren't statistically significant differences between any open or click-through rates. We did see donation rates were 3 times higher when we offered matching funds. So these are just 2 examples of more classic or first-generation BI trials that use traditional touch points like correspondence, such as direct mail and email. I'm now going to move on to a project that's very near and dear to my heart. This is the Canada Learning Bond. It's a benefit in Canada that's offered to low-income families to help them save for their children's post-secondary education. Now, essentially, it's a great program. Unfortunately, only 34.7% of eligible children, so that's not total population, that's eligible children, have this account, and that means that 1.81 million children do not. The challenge with this one is that you need to go through multiple steps to actually get the account. First, you have to open what's called a Registered Education Savings Account, an RESP. To do so, you need a SIN number for yourself and for your child that can only be obtained in person during regular business hours. Once you obtain this number, and I think it's equivalent to your TFN here in Australia, then you go to a financial institution in person, make an appointment, sit down with a financial advisor and tell them you'd like to open an RESP. They then ask you a number of questions about what type of investment you want. Do you want a mutual fund? How many contributions do you want? And then if you get through all that, you get the account. So we ran some nudge trials to see if we could help increase, actually, I'm going to go back a second just to sort of touch on some of the barriers that I didn't say. So there are some barriers aside from the obvious, the one I mentioned around process, but also misperceptions. So people feel that you have to make contributions in order to get this benefit. That's not true. As long as you open the account, we will put the benefit into your account. The second one is subjective distance. So this is, of course, around people not seeing or seeing education for their child being something in the far distant future, something that they're not paying attention to right now in the present. And then low awareness. The program area feels very strongly that it is an awareness issue. If we tell them, they will come. They will follow through with the steps. So here we tried 2 letter trials. The first one, we introduced a redesigned letter. We gave them a bunch of information. And in this trial, we didn't really find significant differences between the interventions. But we did find that it is better than not sending a letter at all. Trial 2, we took it a step further. We divided, we looked at different populations. So people who have just fallen into poverty, so newly eligible, versus existing eligible population. And for this one, we ran 8 interventions. So a modified letter, a simplified letter, and then we added some BI interventions. One of which was a checklist to sort of say, okay, these are the steps you have to go through to get the account. Another one was a mock check, which took us a very long time in approvals. What if somebody goes to a bank and thinks it's a real check? But a mock check on the letter so that it made it more salient, like this is money that you could actually be getting. And so for the newly eligible population, the checklist had a great effect, and we saw a 22% increase over the standard letter. Pretty pleased with that. And for previously eligible, it was a different result where the check actually had an impact. They're a harder group to move, though, but we did see a 15% increase over the standard. So phase 2, birth bundle. So this is getting to more the second generation work that we've been talking about this morning. So in the province of Ontario, Canada's largest province by population, they have something called the birth bundle. It's a great service. It's a 4-in-1. When a child is born, you go online, and in 15 minutes, you go through this transaction. Super simple, and you get 4 things that you need. The birth certificate, you get the birth registration, you get the SIN number automatically. It's fantastic. 99% of parents go through this process. So it's very high uptake. So what we did was we wanted to see whether we could leverage this touch point and add RESP. So the RESP is that savings account I was talking about, and build that into the service and make it a 5-in-1. So we launched that recently in March. with some great results. Our preliminary results are showing 75% of parents are actually completing that transaction. Now, the one thing about it is at this point, it's a referral. So what happens is the parent goes in and says, yes, I would like to be referred for an RESP. The SIN number is transferred, so that does take out that one step. And then they choose the financial institution that they want, and the financial institution then contacts them, but they still have to go in person. Part of the reason for that is there's few banks and financial institutions in Canada that actually offer this service, either online or on the phone. So what we're looking at now is moving to that last mile service. So thank you, Dilip, for that, where we're going to actually have the RESP, the full service, right in Birth Bundle. So they actually complete the entire process, and at the end of that, let's say 20 minutes, they get the first 4 things, plus they get the RESP opened in their name. So in addition to Birth Bundle, we're also looking at working with other jurisdictions. So here we're looking at a trial with Prince Edward Island, which is a small province, small island off the east coast of Canada, to see whether having a communication come from school principals has any effect. So right now, as I mentioned, the government sends a letter and says, hey, Liz Hardy, your son Owen is eligible for this benefit. So would it have an impact if I got a letter from Mr. Garrity at my son's school to say, hey, Liz, you know your son is actually eligible and this is the amount. So we're going to be trying that in the next few months. We're also partnering with the City of Toronto, large city in Ontario, to see whether bundling the Canada Learning Bond or RESP with social assistance appointment has an impact. So in Toronto or in Ontario, if you're on social assistance, which is I think equivalent to the welfare system here in Australia, you go to an intake appointment. So an initial appointment to say, this is my situation, these are my needs, and then you attend a mandatory meeting every month. So we want to see whether if during those discussions, we could start talking about the Canada Learning Bond and see if we can bundle, similar to the idea of Birth Bundle, into that appointment on social assistance. Oh, that was fun. And finally, policy changes. Thank you. So how do we get to 100% uptake? So all of these things I mentioned on Canada Learning Bond, I think, can have an impact, and we're chipping away, and I think some of the things like Birth Bundle will actually help us move the needle a bit more. But if we really want to get to that 100%, and I think this is something you did such a great job of explaining in your presentation, Kate, is things like auto-enrollment. So everybody just, when you're born, you automatically get the account opened in your name. Removing the need for that SIN number completely. So changing the legislation so the SIN number is no longer required. Encouraging banks to move away from an in-person interview into more service-friendly options like online and on the phone. And then also paying the benefit all in one lump sum. So one thing I didn't go into, it's a complicated program, is that when you open the account, you get an initial amount, and then for every year after that you're eligible, you get more money each year. So it's complicated to understand how the structure works. So one thing we're looking at is let's just give it to them at the beginning. So you're eligible, here you go, the amount goes in your account, and you start to accrue interest at that point. And I think certainly for us at the Impact and Innovation Unit, that's really where we're starting to think about real impact of what we're doing. So looking at it not only from those low touch point areas, but where can we make large-scale recommendations to our government to change the way programs and services are designed so that we're not having to do these letter trials over and over again. So that's me. Thank you, and we all look forward to your questions. Should I stay up here? Yeah, okay. I have nowhere to attach my... Sit here. Okay.
Okay, well, thank you, everyone. They were really great presentations. I have a bunch of questions to ask, but we have around got a question for any of our audience members?
Thank you. Julia Featherston from the Boston Consulting Group. My question is to the whole panel, but perhaps starting with Liam. Liam, can you talk a little bit more about that distinction between attitude and conviction? It strikes me that there are lots of situations in which citizens have strong opinions that are actually very loosely held. How do we detect those up front when people tell you that they feel strongly about it, but they turn out not to be convicted about it at all?
Oh, do I automatically come up?
Yeah.
I guess I haven't really thought about the difference between conviction and attitude, but what we do know is that attitudes that are formed on the basis of deliberation, attitudes that are formed by thought process, pondering, wondering, weighing up a suite of different counter arguments, and forming an opinion are really strong and tough attitudes to break. Reinforced by experience. I mean, we think about strongly formed attitudes. Deliberation is number one, so pondering, thought processes. Direct experience is clearly another that can shape quite strong attitudes, as well as behaviour can shape attitudes. So I guess you're right that people can have opinions on things that are not formed by any of those tools, and I would argue they're not particularly strong attitudes. They might be strong in terms of their poles, but they're not strong in terms of their formation, in terms of their malleability.
Would anyone else like to comment on the question?
No, but I have a separate question, so whenever you're ready. I have a question to Kate, actually.
Go ahead.
So I get the point that RCTs can constrain policy making and program delivery, but surely we need evidence, right? I mean, there are other ways of getting evidence. So you're not saying let's not can evidence. You're saying let's not be focused on RCTs. I just want to make sure that.
I'm certainly not saying
Okay.
let's can evidence. I think that I think the field as a whole more and more has looked to other forms of experimental evidence beyond an RCT, natural experiments, etc. And I absolutely don't think that we should do away with evaluation, just to be totally clear. I think it is critically important that we as government evaluate so that we actually understand what works. But my point is more that experimentation is generally evidence generation, which I also think generally is a really good business for government to be in. But to acknowledge that that experimentation before the policy rollout isn't going to be possible in every case, and yet we shouldn't allow that practical constraint to restrict our thinking about what we know about human behaviour and how that's likely to influence policy design itself.
Okay. So if we actually had a regime where we did lab experiments prior to rolling out programs and policies, and then essentially made sure that there were lots of places for testing and short feedback loops, you'd be okay with that?
Absolutely. And I think that, I have plenty of other thoughts about lab experiments and the degree to which they translate or don't translate to the real world.
I'd still say good lab experiments are better than none at all.
Absolutely. And I think evidence, wherever it comes from, is absolutely critical to incorporate into the policy-making process, whether that's evidence about behaviour or whether that's evidence more broadly.
Okay, any more questions from the panel?
I'm sure there will be.
You can have a little chat amongst yourselves.
Just yell out if you need a question. Okay, we have a question over here.
Just on that point, you're talking about experimentation as if it's, a well-accepted principle, but actually, from a policy perspective, I think that's one of the things we're lacking in this country, that we're not brave enough to look at what doesn't work, and we're not brave enough to put that information up to the ministers, for example. Could anyone comment on how to actually create more courage, generate more courage when it comes to experimentation?
Everyone's looking at me.
Okay, so maybe I'll start. So I've been working in this field in government for now, I think 6 or 7 years, first at the provincial level and then at the federal level. One thing I found made a tremendous difference was, I think it was about 1.5 years or 2 years ago, we, the government, so Cabinet Office, our equivalent, so PCO, issued an experimentation mandate. So basically a directive that all departments were required to experiment. So all of a sudden they're saying that, it's not so much about it was that they had to devote a fixed percentage of their work to experimentation. And at that point, I'll tell you, we hit a tipping point. So I have way more projects than I can handle. But I think in addition to that, it's kind of changed the culture for us because now it's almost like, well, why aren't you? And my deputy secretary a few weeks ago was reflecting on a meeting he had with ministers where one of the ministers said, well, wait a second, shouldn't we be experimenting with this? And he said, I almost,
Froze.
yeah, it's like he felt like hugging him and saying like, yes, we should. So I could say for us that's had an impact.
But it is a cultural thing. I think the important thing is framing a lack of success in experiments as a failure is problematic. Right? It's actually, no matter whether your intervention works or not, you learn something. And I think the moment people realize that that's the case, I think it completely changes the conversation. So it really was about thinking through a good vocabulary for communicating what the value of experimentation is. Experiments help us understand what the unseen distributions and population preferences are, and maybe there's none, and that's something we've learned through an experiment. So I think that's the cultural thing is important.
I guess another thing to add, when we look at a new problem or a new challenge, it's really important to review existing evidence. And as academics, we tend to go to peer review or that type of literature. But actually, what's really, I think, just as important is the practice experience of people in the field. They'll tell you what hasn't worked, and they'll probably have a pretty good intuition as to why. And I think coupling that or complementing that against evidence that's come out of trial work, I think is a really good practice to do in the first instance.
And I might be a bad facilitator and jump in to answer a question as well. Thank you, Anne. Just to point out that the behavioural economics team does actually have a published by default approach since we've started out in 2016. And we have indeed published some results where we haven't found the statistical significance, of which we'd be really quite happy to say to a minister, go ahead and implement this intervention that we've tested. And it felt really difficult in our team to talk about what do we do with this, how do we talk about it, how do we frame it in our report. And to the credit of the Department of Environment and Energy, because we were looking at the impact of energy labels in particular, they stuck to the guns, which was part of the commitment to work with us, that we would put that out there, we'd put it out in the public domain. And the Prime Minister's office is enabling us to be able to do that. So we're hopeful that this will help to drive increasing comfort with putting experimentation out there, including when we find something doesn't work like we might have expected. So.
I think, sorry, can I just add to that? I think on that, in terms of changing the choice architecture to the published by default, I feel like that's a really important point. And I think there are other ways we can also change the choice architecture. Like, as policymakers, we rarely assess the risks of the status quo, but those risks are just as real as the risks associated with any new program. So I think there are other things that we can do at a system level to encourage experimentation by, making people realise they're already, implicitly privileging the status quo. Let's find out what actually works.
I'm no PR person, but a trial that fails is, you can very easily pitch that as not wasting money doing that in the future.
Exactly. Exactly. All right, we have another question.
Yeah, Roy Murray Pryor from FNQ, as I always like to say. I would like to make a comment and then ask a question of Kate and the others. This argument about research reminds me of the argument between reductionist and holistic analyses. And if we reduce everything to just experiments, we'll be like the drunk man searching for his keys under the light. Because if you reduce everything to simplicity that can be experimented on, you often miss the big questions. And I think the example, I think it was you, Liam, gave about the thing in Victoria. Was it Liam or somebody who said, the one about, yes, the one with the
workplace safety?
Workplace health and safety. That wasn't done by experiment, and yet it's had a major impact. So, and it's a policy issue. Now, my question comes back to Kate I'm from Agricultural Extension, and we in Agricultural Extension are all about behaviour change, and we recognise that you need to get in at the ground floor, although are not often allowed in at the ground floor, to change. You know, we often get added at the end, a bit like you are. So how do you convince policymakers and funders to allow you in at the start to help design the questions and the issues you identify, and then how you design the project so you'll get better outcomes and better scaling?
I think that's a really good question. And I think that we've addressed that in several different ways. We're lucky enough in Victoria to have a really strong authorising environment at a Secretary of our department level and at a ministerial level to apply behavioural insights to those policy challenges. So I think that certainly helps. But on a more practical level, I'd say that part of the way that we've got to some of those bigger policy questions is actually through having had people bring us much smaller program design, program implementation issues, and then going through a process with those people of saying, well, hang on a minute, what's the underlying behaviour that we want to change here? Is it really about something quite simplistic, like get someone to click this button on that website, or decide which website you would rather go to receive information? What's the real policy problem here? And using a process, very similar to the one that Liam referenced in terms of exploring the problem, the BWA method, to actually understand, well, what's the real behaviour you want to change to achieve the policy objective, as opposed to trying to do a behaviour change project on something that's, you're solving for a symptom rather than solving for the problem itself.
Any other comments?
Yeah, I just want to build on that. I think oftentimes when we put on our behavioral scientists as problem solver hat, we tend to get stuck on those, people aren't clicking because the information is too complex, or the framing could have been different. But I think there are underlying psychological problems that are bigger ones, things like uninterested citizens or whatever you might. So I think it's that step you just talked about, sort of going from the specific problem to an abstraction and trying to understand what the core symptoms are caused by. I think that's critical, because that helps us better think through what the policy challenge is, as opposed to focusing on the band-aids.
Okay, one to two more questions. We have one at the back.
Hi, Varun Gori from the World Bank. Thanks so much for a great panel. I wanted to get the panelists' thoughts on nudges tailored to particular different individuals who may have different social preferences, different risk preferences, different personality types, different demographics. I think my impression is that as the data that we have available expand, and as our measurement improves, we may be able to develop messaging to different kinds of people and go beyond averages and begin to sort of make our behavior change efforts more effective by understanding something about the particular person we're sending a message to. Any thoughts on the promise of that, or any work in that domain that you find interesting?
Yeah, so I'll jump in. I think that's an interesting question, because it also gets to how we think about, conceptually thinking about nudges. And the way I think about a nudge is, if you want to get everybody to do the same thing, then a systemic nudge is the right way to think about it, right? But when you want different subgroups to do different things, then in fact you need to couple that nudging intervention with either education or a decision tool or whatever else. So simple example from Canada is our pension plan, right? So the Canada pension plan, you contribute to it throughout your work life, but you can start withdrawing benefits from age 62, I think, all the way up to age 70. It's your decision as to when to withdraw your pension. But obviously the longer you wait, the bigger your checks are. Right? And so if you're trying to help people make that decision, I suspect a pure nudge isn't the right thing to do. Now, by the way, the data shows that there's a whole bunch of people who withdraw at age 62, and a whole bunch at age 70, and very few in the middle. Right? So there's a nice anchoring at both ends. And so the solution we are thinking of is really kind of a calculator which helps people think through what their family history is in terms of how long do people live, and how much do I have saved in my nest egg besides the plan. So I think that's an example of a situation where a simple nudge isn't going to do the trick, but a nudge to think about it, coupled with the decision aid, is the approach that we're thinking of. So you're absolutely right. I think we now have the ability to kind of develop those kinds of interventions.
It's interesting. Earlier today, we had someone ask Cass Sunstein about Cambridge Analytica, and essentially, I mean, that's where it goes. The reason for the outrage around that was because it was to try and shape voting preferences, whereas if we use that for good, you could highly tailor things that are quite successful. Mm-hmm. And in fact, it didn't shock me as much as it probably should have. It's just that it was done in a context that was unacceptable. I think that's the future. I really do believe that, you know, as big data comes in and intelligent systems and artificial intelligence and data mining become normalised, that these sorts of techniques will absolutely perpetuate.
Okay, with just a couple of minutes to go, I might ask the panel, I want to ask you to nominate just one area where you're looking forward to applying what we call a second generation nudge in the coming year or two, where you think you'll have the highest social impact in your respective domains. So we'll start with you, Dilip.
I think you know, the regulation of the financial marketplace and consumer protection is the sort of big area where I think the second generation ideas that we talked about could contribute to. So that's my pick.
Great, thank you, Liz.
I would say building the middle class, so work that supports low-income families and middle class, and how do we, you know, look at large-scale policy changes that we're making it easier for them. I think the government, we sometimes do a really good job of making things really hard for people. So looking forward to sort of, you know, improving on our outcomes, yeah, in those areas.
So social inclusion, for me, I'm part of a group of an alliance of essentially 80 organisations who are interested in bridging some of the issues around prejudice and a lack of diversity. It's a space where we need collaboration, cooperation and sharing of ideas and sharing of common metrics, and we're very invested in that.
Do I have to pick just one?
Yeah. Yes.
It's a tough question. I think for me, probably preventative health. So, you know, burden of disease that is preventable through lifestyle changes. I think it's a really complex behavioural problem because there's so many different inputs that go into that, and I'm really looking forward to working in that space with some, second generation applications of BI.
Okay, great. Well, I think it's been a fabulous panel and great presentations. I really enjoyed hearing about how to become a behavioural insights organisation, Dilip. That was really great. And bundling online, Liz, in your space as well, particularly around the birth bundles and other programs. The advertisement that you showed was extremely emotional, and I think hearing about how you're bringing together all the different tools and activities to attack the one big issue was really great. And Kate clearly believes in evaluation as much as possible.
For the record.
And at all times. But, you know, it's great to hear about how can we start applying behavioural insights further upstream in the policy cycle. So that's one for us all to think about. So please join me in saying a really big thank you to this crowd and get in touch if you have questions.